Dr. Murdock has spoken to this group several times in the past. We've been going now for like 26 years, and has graciously offered one more time to share his knowledge and his time and his expertise and his photos. So without further ado, Dr. Murdock. I'll get some more water for you. Just hold it up here, not down there.
Okay, very good.
And there's your pants.
Excellent. Well, this is an amazing group today. I'm in awe and humbled by your presence. I do want to thank Healthy Ages for inviting me again to speak. As mentioned, I've spoken before, and I was just thinking back, it was maybe 15 plus years ago when I first spoke to the Healthy Ages group, and at that time, I had no thoughts about aging, personally, and this was all for you guys. But now, as I approach my Medicare years, and you can see from my, if you would have seen the hair color in 15 years ago, of course, it would have been a little different. So this is the title of the talk in those days was geriatric care, foot care. And so we amended that a little bit because it's foot care for not just you, but for me as well at this time in my life. We have been practicing here in Richland for about 29 years. And it's been a real pleasure to raise a family and be a part of this community. It has been said that aging is becoming very stylish because everybody is doing it. And so what I'd like to start out with today is a couple of nice pictures while I bore you with some statistics. Life expectancy in 1930 was about 60 years. And life expectancy, and at that time, there were about 7.8 million people who were 65 years and older. Today, life expectancy is nearly 80% if you average all of the different social classes together. And there are about 40 million people who are 65 years and older. And it's estimated that in another 15 years, there will be 72 million people 65 and older, and that'll account for almost 20% of the population of the country. And so health issues regarding aging have become really important to all factions of medicine. In fact, the specialty of geriatric medicine hasn't been around for very long, but it is becoming more and more important and popular. And so from my end of the spectrum, foot and ankle disorders, we also are involved in treating and trying to prevent a lot of the problems and diseases that can occur in the aging population. And these conditions are very significant because without proper attention to conditions of foot and ankle and leg, whether these are cared for properly can make the difference between being able to live independently or to be institutionalized. And of course, we want to make sure that we can be as independent as possible. Part of the kind of the buzzword in the last 2 or 3 years, in our profession at least, has been in the areas of fall prevention. And that's been a big issue in the aging population because of the trauma, of course, and the cost of repairing hips and femurs and shoulders due to falls at home. And so this has been a big push in all that we do. And as part of the aging process, there's an increased incidence of disease involving these four areas, and this is kind of where this presentation will focus on today. We'll talk about vascular diseases or circulation issues. Skin disorders is a big problem in elderly people. Bone and joint disease, and we'll talk about some other medical associated conditions in the aging population. Vascular disease is important, and it refers to, of course, to the circulation. This includes both the arterial blood supply, which is the blood full of oxygen pumped from the heart to the various organs and extremities. It is very important in foot and ankle conditions because, as you know, the foot is the farthest thing away from the heart. And the blood has to flow the longest and through more obstacles to get to this part of the body. The venous system is the blood supply that travels the opposite direction. And the vessels that it travels through are much thinner, not as muscular, and they also have more prone to disease. And it also has to fight against gravity, which is a big deal in blood flow. And so the blood supply to the foot is very extensive. There are major arteries that come from the top of the leg and from the bottom and behind the leg, and these are important. As the patient ages, the blood vessels lose some of their elasticity, allowing for slowness of blood flow or sluggish flow. And when combined with additional vascular disease, a dangerous condition can occur that can jeopardize not only foot health, but actually the foot in general. This is a kind of a fuzzy picture, and I apologize for that. But the arrow is pointing to a structure that you can just barely make out next to that bone. It's a calcified artery. And we see this quite often as we take x-ray of diabetic patients and patients with vascular disease. There's still blood that flows through that artery, but it's the opening or the lumen of the vessel is much narrowed, and the vessel itself is very, very hard. So there's no pulsation of the vessel, and the blood flow is very limited. So when this occurs, it's a big red flag for those who have these calcifying arteries. Walking is an important form of exercise for you and I and all of us who are aging. And one of the symptoms that is that we all need to know about is called claudication pain. And what that refers to is if you can't walk for more than 2 or 3 blocks without having cramping pain in your calf muscles or your thigh muscles, this is a really serious problem that you need to get taken care of and looked at. Muscle requires a lot of oxygenation in order for muscles to work properly. And if there's an occlusion of blood flow or a diminished blood flow, and the muscle is exercising, it gets starved for oxygen, and that creates a great deal of cramping pain. Typically, a person, as this picture shows, will either stop walking, sit down for a few minutes, and that pain will disappear. But as you start walking and standing and exercising again, then that kind of pain comes right back. So claudication pain is a real important risk factor for circulation. Aside from these very severe symptoms of cramping, there are more subtle symptoms that you should be aware of as you evaluate your circulation, and especially the arterial circulation. There are pulses in your foot on the top and in the back, and I don't expect you to know how to palpate those or find where they are, but the lack of pulse in the foot is an important risk factor, whether it's present or absent, for circulation issues. What this slide is trying to depict is that this is a patient who has no hair growth on his lower legs. And the lack of hair growth can be a sign of decreased circulation. The skin requires a lot of circulation for hair follicles to mature and to grow. And so a lack of hair on the skin is a significant finding for circulation issues. Skin and nails are an issue for if you have poor circulation. Typically the skin is very dry and scaly, and it can become very, very thin, as well as nails can become thickened and misshapen and deformed if the circulation isn't very good. If you progress to a point where there is actual occlusion of blood vessels, then of course we run into the categories of gangrenous kind of situations where parts actually are dying. And so this is the piece that none of us like to see, but we see too much of it in emergency rooms and in our practices, that we don't want this to happen to anybody, but it unfortunately does. Risk factors, if possibly were looked at, some of these things can be prevented. Right now, the vascular surgeons are doing incredible things higher up the leg to restore blood flow to the lower extremity. On the other side of the circulatory tree, there is the venous circulation. And as mentioned, the vessels on the veins are much thinner. There's no muscular component. The blood flow back to the heart requires going against gravity, and so muscle contraction is really important for blood flow back to the heart. And that's why exercise is an important aspect in guarding against these kind of problems. Veins have a lot of valves in them, kind of like the locks on the river. The blood flows up to a certain level, a valve closes, and muscle contraction pushes that amount or that volume of blood further up the circulatory pathway. If these valves are injured, then we can get chronic swelling, varicose veins, and all of those kinds of things that we see in the aging foot and leg. And so elevation is an important aspect of returning blood flow back to the heart, because we have a difficult time fighting gravity if these valves and vessels are not functioning properly. This is a slide that tried to depict, this is the knee, let's see, where it is. This is the knee and leg up this way, and the foot is down this way. The person has been wearing a support stocking that's really, really tight, and that can create some problems. Support stockings are an important treatment for chronic venous insufficiency, chronic swelling, but we have to be really careful not to put too much pressure around the knee or the ankle, where these things can be occluded. If there is inadequate return of blood flow, and there is pooling of blood from either the veins, or there's even a deeper system called the lymphatic system. And that is a very, very delicate vessels that carry blood flow from the cellular level to the veins that carry it back to the heart. If these are damaged and the veins are damaged, we get this chronic discoloration of the ankles. It becomes very hard, very discolored, brownish, reddish sometimes. And then the skin becomes very, very fragile, and it can break down and create these ulcerations. The worst case scenario of the venous system is if it's occluded by a blood clot. And this slide is a venogram showing that the blood flow is completely blocked at that level, going back to the heart. So it's important, and a lot of us will have, because veins are kind of the first thing to go in our circulation as we age. And so swelling of the foot and ankle, very, very common. Important to keep a good exercise program going so the muscle contraction can return the blood flow back to the heart, as well as elevation and sometimes compression as necessary. Another issue that we'll focus on is skin disorders. Skin changes can occur as a natural part of the aging process, and we saw some of those in the foot as the blood vessel, as the circulation gets worse. Skin changes occur pretty readily. Some of the features that we see in aging skin, and you all know, and my grandson poked at me like this, and he says, "You've got grandpa skin." And so it gets thin, it gets shiny, it bruises easily. All of these things are kind of the things that happen with skin disorders. So it's important, to kind of combat these things is proper hydration, using lotions, emollients, exfoliating kind of things that will help restore the health of the skin. In our practice, in foot and ankle things, we see a lot of these kinds of problems with skin, commonly the corns and the calluses. Now, typically they'll form over bony prominences. If you've got a toe that's a little bit crooked and it rubs in your shoe, you'll get a callus formation. And that's kind of the body's defense mechanism against injuring and eroding through the skin. These things can occur on the top of the toes and between the toes, and those are the common corn kind of things. If it's a callus, it's on the bottom of your foot. And those areas also are prone to weight-bearing pressure due to the fact that a lot of times the natural fat pad on the bottom of the foot will thin as we age, and then the bones that it's trying to protect will then be too close to the surface, and there'll be too much weight-bearing pressure, which will cause these deep, painful calluses to occur. Dermatitis is another common problem in not only aging population, but as we deal with anybody, but it seems more prevalent as we age. Our skin becomes a little more susceptible to these kind of irritating, whatever it is, whether it's laundry detergents or change in clothing that we wear. Anything that can be an irritant, a contact irritant to the skin, can create these things. It's said in dermatology that the skin, if it's dry, you wet it, and if it's wet, you dry it, and that's kind of the treatment options for dermatitis. And we also know that the skin only reacts in a few different ways to a lot of different stimuli. Skin can get red, it can blister, it can crack, and so the treatment is to combat those kinds of things. We also see a lot of athlete's foot or fungus infections, which can become really an issue, especially if you're a diabetic and you have we don't want to look at that too much longer. If you have diabetes, infection can occur. A secondary bacterial infection can occur if the skin is broken and there's any kind of oozing or weeping, draining lesions. So that's really important. And then nail fungus. And I don't know if there's anybody in here who hasn't seen either yourself or somebody else who has nail fungus. But it's It's probably one of the more common things that we see. It is treatable, and it is an infection, and so it's a good thing to get that taken care of. And there are some fairly inexpensive ways to take care of that. The recurrence rate is really high, but at least there are some treatments that can be used. And the FDA is announcing that there will be a couple of new antifungal nail treatments that are going to be made available to us at probably the first of next year. Infections are a part of a skin problem. You want to make sure that you know the signs of an infection. Redness, local heat, swelling, and pain. Those are kind of the signs of infection that you want to be aware of. And these are things that can look very maybe mild at first, but again, if there's underlying vascular disease, if there's diabetes involved, I've seen these things go from a simple ingrown toenail to an amputation in less than a week. And so it's really important that these things be taken care of. Other less common, but sometimes more serious, are some of the skin cancers, whether it's benign or malignant. These skin lesions can occur on the feet. They're not as common as other places on the body, but melanomas and basal cell and squamous cell disease can occur in different locations on the feet. Here's a very benign-looking nevus, or a mole, but sometimes these things can be very aggressive and need to be biopsied and treated very aggressively. Plantar warts. We honestly don't see many of those in adults, but they can be a concern. And when they are in adults, they do take a lot longer to get rid of, and they're a lot more painful than when they're in kids. And this is one of the characteristics of an adult onset kind of wart, is where there are clusters of them. We call this a mosaic wart because there's just multiple vesicles on the one heel. And psoriasis and other kinds of autoimmune disease, dermatitis can occur. So again, it's an important aspect of foot care to be aware of these things and to get them taken care of. Again, these are really kind of unusual, but can be seen in diabetes, where the skin takes on this kind of reddish, brownish discoloration. Kind of the end result of venous disease, arterial disease, can be ulcerations, and we don't want to spend much time here because these are ugly as well as just noxious in about every imaginable way you can think of. The odor, the sight, the disease that it can cause, and the effects that can occur from these kinds of problems. But they're out there, and more often than not, we're amputating parts of the foot and sometimes the leg as a result of these things that are left untreated. And people with diabetes have a condition known as neuropathy a lot of times, and that is the most insidious piece of the whole diabetic picture, is that a person may have something like this and not even know it's there unless they looked at it. We've seen, in fact, just this last week, a gentleman came in the office. He'd been walking around with a nail in his shoe for about 2 weeks before he actually knew it was there, other than he'd take his sock off, and there was a little drainage. It got worse and worse, more infected, and he's about almost to lose his foot. So it's important that you look at your feet on a daily basis if you are diabetic. Bone and joint disorders. Probably one of the most common pieces of the aging process. In fact, I just had my first joint replacement surgery done. And so it's out there. And I can imagine if we had a raise of hands, there would be quite a few who have had hips and knees replaced in this room today. We talk about arthritis. It's a disabling, disfiguring disease, especially if it's the rheumatoid version. In the foot, we have a very common condition where people will get arthritis of their big toe joint. Similar to the knee and hip, the joint cartilage disappears, the joint expands and gets thicker and wider and becomes very stiff and very painful. Other deformities that can cause arthritis are the bunion and hammer toe deformities. And a lot of people with arthritis will have these kinds of conditions. As you can imagine, this is not a foot that's easy to fit in a shoe. And so it's a difficult proposition for these people to be able to walk and stand and perform any kind of normal daily activity because of the condition of their foot. Collapsing arches, all of these kinds of bone and joint diseases. Again, rheumatoid disease is very disabling, very disfiguring, and one that we see on a daily basis. Affects hands and feet, and a difficult process to deal with. All right. Anybody who's had gout in the room? Okay, a few honest souls. That's very good. This is the disease of kings. Typically brought about by problems in metabolizing protein, and we see it. And it, for some unknown reason, it affects the big toe joint more than any other joint in the body. Red, hot, and swollen. It's pretty unmistakable if a person has gout. It can be kind of a nuisance disease unless it gets to the point where, and this is kind of a picture where even the redness around that big toe, it's typically 3 or 4 times that red in an acute gout attack. The real problems occur in the chronic. When this thing becomes chronic, it develops almost like a cottage cheese-like material that forms inside the joint, and it can create a huge amount of arthritic change, erosions of the bone and joints, and skin disorders, as you see here. In osteoporosis or osteopenia, again, a very important piece of your education to know where you stand with this condition. We see quite a few times where a person will come in to the office. All they'll relate is they've got a swollen foot. And we take an x-ray and you can see that there's quite a serious fracture right there. That requires an operation to fix that. And there was no jumping, there was no twisting, there's nothing that fell on the patient's foot. It's simply a matter of bone weakening to the point where it just pathologically fractures without any real cause. So with all of that in mind, there are treatments that can be available for all of these conditions, especially the arthritises. Physical therapy tools can help reduce inflammation and pain. There's a huge variety of medications that you can take for arthritis. Injectable things have worked out to be very, very useful, where an injection maybe once or twice a month can reduce the symptoms of arthritis a great deal. And then surgery can be a useful solution to arthritis as well. If you remember back to the picture that was so deformed it wouldn't fit into a shoe, those kind of reconstructive surgery procedures can really be a great blessing in a person's life so that they can become active again and hopefully live a more productive life. So, The concluding take-home message today, I hope, would be that we should do all that we can to guard against, to know, first of all, to know some of the signs and symptoms of circulatory disease, bone and joint disease, skin disorders, diabetes, infection, all of these things that can make our quality of life not so great. And we certainly want to make our sunset years the best in quality, because we know the quantity is going to be there. So we want to improve the quality of these years. And I hope that by coming to these kinds of meetings and becoming more informed, taking care and taking responsibility sometimes of your health care, and following up with your physicians, the quality of your life can be improved. And I thank you for your attendance here today. We do have some time for questions. Yes, sir. If there is, that's a great question, yearly exams for the feet as well as other body systems. Certainly if you have diabetes or one of these arthritic conditions, once or twice a year would be highly recommended. If there's no real underlying disease, then kind of as needed. Yes, that's a good question. In choosing a lotion or a cream for your feet, you want to get something. If you got callus formation, you want to get something that has some sort of exfoliant in it. Lactic acid is one that's usually available. Peppermint extract is one that's available in lotion form. Those are really good to exfoliate. All the lotions are usually going to be pretty good. Try to get something that doesn't have a lot of fragrance in it. That can create more dermatitis than others. And the thicker the lotion or ointment, the better it will be on a callousy kind of scaly skin. Yes, sir, in the back. If you are diabetic, Medicare will pay for diabetic nail care or at-risk nail care every 60 days. There are some registered nurses in the community at the Richland Senior Center who will trim toenails if you're not diabetic. Yeah, that's usually the case. Is we all find that as we get older, our feet get farther away. They really do. Yes, sir, ma'am, over here. If it's on the, typically if she's asking if the cause of calluses on your feet, most of the time it's caused by some kind of friction, unusual friction. If there's a bony area that's not protected by a fatty pad, sometimes that'll thin in the aging process. Those bony areas can become callous as well. So it's a lot of friction that usually causes it. No, Neutrogena makes a good product. Eucerin, Bag Balm, the old, those are great products for scaly feet. Yes, sir, in the back. There are a couple that are good. You probably should talk to if you're diabetic, your diabetic doctor. There are some on the market that are FDA approved for neuropathy. One is called Lyrica. There's another one. Lyrica has a few dozen side effects that some people do well with it, some don't. There's another medication that's again FDA approved for diabetic neuropathy called Methanex, and it's a combination of vitamins B12, B6, and folic acid in kind of mega doses, and it's been remarkable to help with diabetic neuropathy, and very, very normal and very well tolerated. Yes, right in the stripes. Yes, she's asking if there's a pain on the top of the foot that's usually worsened by wearing shoes. it's typically an enlargement of bone. That's the most common thing. Now, there are some nerve and blood vessels that are on the top of the foot that are very close to the surface, and those can be irritated as well. But usually it's an underlying enlargement of bone that causes those kind of things. Yes, ma'am. There is a treatment of fungus to the toenails. The one that's been around the longest and is now the cheapest is called Lamisil, and it's an oral medication, but it does have some liver side effects, although those have been highly maybe blown out of proportion, in my opinion. There are a couple of topical medications that are going to be coming on the market probably the end of this year and the first of next that show some promise in their clinical studies, but so far there's not a lot of good antifungals out there except for that medication. Yes, ma'am. Oh, the question is fungus treatable if it's been there for 40 years? And the answer is yes, it is. Yeah, it is. It is. Yes, in the blue right here. Good question. The question about burning, tingling sensation in your feet, whether it's related to type 1 diabetes or type 2 diabetes, or if you've had diabetes for a long time. And yes to all of those questions. Sometimes we see the first presenting symptom in a type 2 diabetic is neuropathy. And that's kind of the first clue that some people have that, oh, I don't feel this, or I'm tingling, or it feels like I'm walking on a piece of cardboard all the time. So it can happen at any stage and to either type 1 or type 2. Mm-hmm. In the back there. The question about tea tree oils and green tea oils. There's a lot of internet cures for fungus out there. The other one is oil of oregano, Vicks Vapor Rub, all of these things. There's been no clinical studies or trials, but there's been a lot of people who are giving a thumbs up to these kind of treatments. And of course, they can't hurt you. Kind of makes your feet smell better too. Yes, sir. Yeah, there are those non-diabetic neuropathies. And there's a great word that we use in medicine called idiopathic. That means the idiot doesn't know what it is. But some of those same treatments are useful for that. Yeah. Yes. Cymbalta for diabetic neuropathy. It's an off-label treatment, but it has been used in the past for that. It's a antidepressant, but it has some effect on neuropathy. Yeah. Yes, ma'am. What can be done about bunions short of surgery? We are always trying to find the answer to that. Bigger shoes. There aren't a lot of good splints or braces that you can wear in shoes that change that picture. You can put a splint on at night that'll pull the big toe over or protect that bump on the side of your foot. But there's nothing that you can wear in your shoes much that'll change the shape of those things. Ice, anti-inflammatories, sometimes arch supports can be useful to reduce some of the pressure against that big toe joint. But if it's a pretty long-standing deformity, you can treat it symptomatically with aspirin or Aleve or ice. But there's not much that's going to change the shape of that foot without a little operation. Yes. Well, I shouldn't say easily all the time, but it's a pretty common procedure nowadays. Yeah. Yes, in the back. Yes, there are. The question is about reversing the effects of claudication pain. As I mentioned, the vascular surgeons are doing a remarkable job with devices, stents, minimal invasive kind of procedures to create more blood flow and to bypass blocked vessels, to create more blood flow to the area that's starving of oxygen. So we've got a couple of really good vascular surgeons here in town that are doing a lot of good work with that. Yes, next two. What does it mean if there's no feeling in the balls of your feet? It could be several different things. We talked a lot about neuropathy here, and that's probably high on the list. There can be some nerve entrapment kind of syndromes that cause that. Neuromas. There's an area in the ankle that's very similar to the tarsal tunnel of your wrist, and sometimes nerve compression injuries can cause some problems in those areas as well. Yes, ma'am. Yeah, it's got a new name. She's talking about a broken foot, and then there's a syndrome that occurs afterward that creates more pain, more disability than the fracture ever did. It used to be called reflex sympathetic dystrophy, and now the whomever does these things has changed it to complex regional pain syndrome. And so, but it can be very disabling, and it's something that if you have we sometimes experience it after an operation where our patients will develop more pain than should be there. The foot kind of turns a darkish, grayish kind of coloration. It's swollen. It's warm to the touch. Sometimes it's kind of clammy sometimes. But these things can go on and on and on, and you don't recover from some things like that sometimes. So aggressive physical therapy is really important after an injury like that. Yes. Yeah, cold feet. Okay. I think I might have had that on my wedding day. But it can be a problem, and it's sometimes one of the presenting symptoms of neuropathy. Sometimes people will have that sensation of coldness, and they'll have this peripheral neuropathy. It can be associated with circulation. It can be a nerve kind of issue. So a good examination would be most important to have done. Yes. Good question. Blister prevention. If you know you're going to go out on a walk and you have a history of blister formation, you can get some even like Vaseline and put that on the areas that are potentially blistered. There are some really good stockings that you can get that prevent blister formation. A particular brand is called Thorlo. And it's a good one. There's a product called Second Skin, made by a company called Spenco. And you can sometimes apply that. It's a lubricating kind of film that you can apply to blistering areas. Sometimes people will put powder in their shoes. That's sometimes a prevention to keep the foot a little cooler, a little drier. Those are the things you want to try. Yes, sir. Yes, warts can occur anywhere. It's the same virus, whether it's on your hands or your feet or the tip of your nose. It's the same virus that causes those. Yeah. How much time we have left? Oh, okay. Let's see. 2 o'clock. Yeah. Way in the back. Toenail thickening. Is it natural in aging? And it can be. The only way to tell if it's fungus is to culture the nail itself. But it can be just a form of rubbing in shoes and socks that cause the nail to get thicker as we age. Yes, ma'am. Yes, it is. You may modify it a little bit to make sure that you're taking all the precautions against blister formation. because you may not feel those kind of things. You want to make sure you stay on a very even surface, not a lot of terrain differences. Like a track or a bike path or something that's pretty consistently even and level. But yes, a good exercise program, yeah. Yes, ma'am. There are, she's asking if there are insoles that are recommended for painful heels and other foot pains. And there's a whole bunch of them out there. I have to say, even though I graduated from the Scholl College of Podiatric Medicine, is to stay away from his products. Is to, he's gone to the dark side, Dr. Scholl has, in my opinion. And so I mentioned a company called Spenco. They make a big variety of insoles that are highly padded that can give you some good relief. There's a store in the mall called the Walking Company. They have a pretty good insole there as well. But you want something that's cushioned as well as provides friction relief. But Spenco, you can't go wrong with that product. Last question. Yes, ma'am. Well, again, that's a good question. Should we challenge our feet? I think with any kind of walking program, you are doing that. Just the normal mechanics of walking. It's a fascinating study to see what muscles work at what point in time during your walking gait. Whether it's when your heel hits the ground, when your foot is flat on the floor, and when you're pushing off, muscles are working in different phases during that walking process. So I would suggest that you stay away from shoes that are very stiff and very, very thick, and find something that's more flexible, and that will exercise your feet just fine. Thank you so much.
I just want to add one thing, all of you who may want to start walking. Healthy Ages supports the Columbia Center Mall walking program. They open the mall at 7:30 in the morning. It's a nice flat area. We'll even keep track of how many times you walk around the mile and give you prizes. So if you are interested in maybe starting a walking program, that's a nice, safe place. You have lots of people around you, and there is a volunteer Monday through Friday from 8 until 9 in the food court, and you can sign up there. Thanks for coming today.